Today's topic is paranoid personality disorder. Paranoid personality disorder is a mental disorder that is marked by paranoia and excessive distrust and suspicion for others, even when there is no reason to be suspicious. Paranoid personality disorder is one of a group of conditions called eccentric personality disorders. An eccentric personality disorder means that the person's behavior may seem odd, peculiar, or unusual to others. A person with paranoid personality disorder has a tendency to interpret the actions or intention of others as deliberately threatening, demanding, or malicious. As a result, they find it hard to confide in others, even when they prove trustworthy, for fear of being exploited or betrayed. They may be quick to feel anger and feel hostile toward others. These generally unfounded beliefs, as well as their habit of distrust, might make it hard for them to form close relationships. The disorder appears in early adulthood and is more common in men than women. A person with paranoid personality disorder is at a greater risk for experiencing depression, substance abuse, social anxiety disorder, obsessive-compulsive disorder, and agoraphobia. Causes. The exact cause of the disorder is not known.
It's not paranoia if
It's
it's
believed that
true.
a combination of biological and environmental factors can lead
And it's
to
just
paranoid
observation.
personality disorder. Risk factors for developing the condition include a family history of schizophrenia or delusional disorder, early childhood experiences,
I
including
gotta watch the planes.
or emotional trauma. Symptoms. Have chronic and pervasive distrust and suspicion of others. Are hostile, stubborn, and argumentative. Have trouble relaxing. Have trouble working with others. Are unforgiving and hold grudges. May believe that friends, family, and romantic partners are untrustworthy and unfaithful. Are generally and often described as cold and distant in their relationships with others, and might become controlling and jealous. Are reluctant to share personal information or confide in others for fear of the information being used against them. Are hypersensitive and do not take criticism well. Read hidden meaning in the innocent remarks or casual looks of others. Diagnosis and treatment. Diagnosis is usually based on symptoms, a physical examination to rule out other conditions, a thorough psychological evaluation that may require discussing your thoughts, feelings, and how you would respond to an imagined situation. This is to gauge how you might react to certain situations. The diagnosis must follow the criteria written in the Diagnostic and Statistical Manual of Mental Disorders, or DSM.
Hey, that's my teammate you're talking about there.
Treatment.
Behave.
The main treatments are psychotherapy and medications. Because of the reduced level of trust, treatment is challenging. Many people with the disorder do not trust their doctors and may not follow treatment plan. Psychotherapy may be effective to help you understand your condition, how to cope with the disorder, communicate with others in social situations, and help reduce the feeling of paranoia. The form of psychotherapy used is the cognitive...
Alright. No further links, chat. No further links. We have a Baba G sponsor segment.